Okay, my name is Immaculate Amondi. I am from Homa Bay County, but currently I stay in Kakamega. I am a mental health advocate, SRHR advocate, and a counselor. Growing up, I wouldn't say that it shaped my SRHR journey so much, because we didn't get to talk about majority of the things that I know now. My parents were good parents. My dad was a good dad, but at no point did they ever mention anything to do with SRHR or sexuality or anything to do with that. So when I joined campus, I joined peer counseling club. And from there I got to receive different stories, rape cases, teenage pregnancy, young motherhood, mental health issues. So from there, the experiences that I got and some of the things that I experienced myself shaped my SRHR journey.
I grew up in being a firstborn to a young mom. We could share stories of how she grew up, and from the discussions that we used to have, it was clear that my mom did not have the knowledge at a younger age on reproductive health, on just taking care of herself as a woman, the knowledge that is passed down from a parent to a daughter. So this one became quite clear to me that I'm supposed to work hard and I'm supposed to go to school and do what took me to school, and also avoid relationships or men specifically, as we are taught a while back that you will get pregnant, you will drop out of school. She made them come out from a point of consequences and not from a point of education or learning.
I never dated until I was in 4th year. And then I decided to give a chance to somebody I thought would do forever with. And then, you break your rule once, and there I was, pregnant with my baby. At first I didn't know what to do. I felt, the first thing I thought was to abort, but then later I couldn't see myself doing that. So I carried the pregnancy to term, gave birth, and then after giving birth, I experienced postpartum depression, very extreme. Nobody could reach me for 9 months, and I don't know, 1 year and something. I blocked my number, except for my mom and my sister, my brother, my siblings. So the experience shaped me in different ways. I thought I was so stagnant. I looked at the baby as the source of my suffering, the reason as to why my things are so stagnant. And then I sought counseling, and it took a process to heal. But when I felt that I was fully healed, I wanted to share with other girls, ladies who are going through that. Yeah, so from there I decided to form a small group dubbed All Things Young Moms. Initial vision was to have a group where we talk like a debug. You just come, you talk, you tell me your issues, you feel that I feel you and I understand you, we relate to the story, more of trauma bonding, and then maybe talk about economic empowerment, and yeah.
My experience with my first menstrual cycle was a nightmare. I started my menstrual cycle at around 9 years old. It was so early that my mother was flabbergasted. She took me to the hospital to ensure that everything is okay. And it started when I was in school. So you can only imagine, you have no information. Teachers are very hostile. Everyone will laugh at me. And I was in a mixed school. So there are boys, there are girls, everyone will laugh at me. And the fact that I was the only girl in my class that had started my menstrual cycle. So there was a shame around that. And it took me a really, really long time for me to know how to maneuver around my menstrual cycle. I think I was in high school. It was a very traumatic experience for me. So why I decided I want to become an advocate because of my experiences is I was very introverted. So I did not have anyone else to share anything with. Everything, I feel like when I was a teenager, I learned everything through books. We did not have like internet back then. So it's either through books or through watching movies. I felt like that is not a good platform to learn, and you're not really experiencing things from the context of where you're coming from. So I was like, what if I uptake these issues and see how I can contextualize these problems that women are facing? We have discussions around it. We have open conversations. So that was just like sparking moments for me. How women have been affected by these issues is first and foremost, they have been infringed to a point that they're not open to have conversations. Women are not really sharing their experiences, they're not talking about sex, sexuality, they're not having conversations that will help them understand their anatomy better, to improve their quality of life. So people are so caged. Conversations like menstrual cycle are seen as a taboo. Women should not have such conversations. Something else is unsafe abortion. Unsafe abortion is really causing a lot of deaths in our community because we are not really having conversations. Young women do not know the channels to use, where to go and seek help. So wana prefer waende in secret and they go to the quacks. People in the community who are not really licensed to practice safe abortion, and we end up having things like death, infertilities, and stuff like that.
Integrating SRHR in the community has not been easy, though we've made so many good steps, visible steps towards that, changing people's belief, but we are not yet there. The cultural, the religious beliefs, most when these girls are trained and they go with a contrary opinion to what the community is used to, they're being termed as, this is why you are here, this is why you are a single mother, this is why you got yourself into this thing you call a space, and you're not doing anything good, you are a bad influence to the community, and we don't want to listen to you. But then later, I joined YCK, and I was exposed, and I was taught, we trained about SRHR, and I realized this is something that we've not been able to talk about, and this is what led us here. The lack of knowledge or the wrong information that we had is what made us teen or young mothers. So after getting the knowledge from YCK, we went back. I started working on enlarging the group, involving more young ladies. And then we could openly talk about sexuality, GBV. Then you realize everyone who is carrying a kid is not that they wanted to get a kid or they went there willingly. Most of these ladies are assaulted and they could not talk to anybody. They have a kid they don't even love because they remind them of whatever experience they went through. So we were able to talk about family planning because these are young girls. When any one of us experience any gender-based violence, we report, we talk about it. They know what GBV is, they know their rights, they know what they are supposed to do and what happens.
So Youth Changes Kenya is a community-driven organization. And we are community-driven because we work with communities, but we focus on working with adolescent girls and young women from the ages of 10 to 28 years. We work in 4 different counties: Kakamega, Vihiga, Nairobi, and Kiambu. And our mandate is very simple, ensuring we have a violence-free society. But apart from that, we want to make sure that we reduce the rates of rape, defilement, but also promote sexual reproductive health and rights. We currently have different programs. So we do have a girls' education project, and it does something very simple but very, very impactful. I think it's one of my star projects, yeah? And we focus on taking teen moms back to school, and especially those who've dropped out. So take them back to school, they complete secondary school education, then after that we reintegrate them to join colleges and university. Apart from that, we also have a very strong sexual reproductive health and rights project. And the aim of that project is to basically ensure that we have open, candid, and honest conversations about sex, consent, relationships, HIV, contraception, safe sex, name them. We want young women to have the capacity to make decisions about their bodies, and we want them to be informed.
The journey has been so beautiful. I would start by sharing about the staff. You know, when I went to their first training, I was like, oh, what if they ask me so many questions? What if they say I'm not worthy to be in this space, you know? But during their sessions and trainings, the modes that they use in their discussions are those of encouraging you, and they are, I'd say, community oriented, because at that time I was the community. They were speaking to me and they listened to you, and I will just say they continue doing the work that they're doing, and I'll continue being a champion on the ground for them.
So from the Thamini Usawa sessions and seminars, I actually learned a lot, and from the seminars, the knowledge and skills that I've gained, I took them back to my community. First, I empowered them, and as it is said, knowledge is power. When someone is knowledgeable, he knows what to do, he knows what is right and wrong. And from that, my community and the people I engage, that is teenage mothers, they've been able to make the right decisions, they've been able to use contraceptives, they've been able to go back to school. Those who have been defiled or undergone GBV cases have been able to follow the right procedures and get justice. And YCK itself has been so profound in our training and boosting my confidence. Yeah, there are a lot of things I got to learn from them, how to defend myself. I got to learn that feminism is a tool we can use to empower women, and it's not war against men. I got to learn advocacy at a different angle and a different level. I got to understand that my voice matters, and anything that I feel that should be done, no matter how little, as long as I know it can bring change, I should speak it out. So I was knowledgeable, I got the proper knowledge, proper wisdom, proper ideas that has shaped my advocacy.
When we speak of intersectionality, we want to solve issues from an individual perspective. I am Hilda. I am a woman. I am young. I come from Western region. There are so many people who identify as young. They come from Western region. They are women, though they are not Hilda. I have my own unique challenges. Someone else has their own unique challenges. We have people who are living with disability. We have people who are not gender conforming. So we have so many people in our community. When you talk about intersectionality, we want to include each and every single person when we are advocating for issues, when we are talking about issues, finding solutions. How can we find solutions for someone who does not identify with any any gender, how can we find solutions to someone who is deaf? So intersectionality helps us to really dive into specific solutions of young women in the community.
So we've been training them on intersectionality, and it's been a training that has been happening from year to year, and we are closing it out today. But one of the things that I must say is I am extremely proud of them. And from the conversations we've been having the past 2 days, one of the things that is very, very clear for me is the fact that they have been engaging in policy spaces, and they say they will continue to pull a seat and take themselves to the table even when they are not given those seats at the table, which for me is something that is very powerful. It tells you that their levels of self-confidence are very high, and of course I can attribute that to the project, because this is one of the things that we've really been telling them, that if you really want to make the change that you seek to see, you have to make sure that you also speak out and also stand out. So just having listened to them and seeing them being able to articulate issues, having seen their self-esteem increase, seeing them sit in technical working groups in the different counties, and also influencing policies that are being developed at county level, for me it's a major highlight. And also ensuring that they also support survivors of sexual violence in their different communities to access legal, psychosocial, and medical support is something very key. I've also taken note that they have been able to take these conversations even in spaces like church, where it's difficult for us to have discussions that relate to sexual reproductive health and rights and sexuality. So just hearing from them that they currently have spaces where they can have open discussions about sexual reproductive health and rights, and especially in church, I feel for me like that's something very, very, very major. We want to see a violence-free society. We have been witnessing a lot of cases related to femicide, intimate partner violence, and again, defilement and rape. Still, the cases are so many, yeah? So for me, I would want to see a society that's free from violence. I want to see a society where I will not walk outside as a woman and I'm feeling unsafe. I'd want a safe society for girls, women, for boys, for everybody. I'd want a society where we can openly talk about issues that are perceived as taboo, especially sex and mental health, which is one of the things that is hindering a lot of, it's hindering treatment, care and support as well. I want to see a society where we are not fighting and saying, oh, we are doing too much for the girl. What is the place of the boy? But a society where men are also standing in the gap for the boys, the same way women are standing up for girls, men also taking up that space and saying enough is enough. I'd want to see a society that's more empathetic. I want to see a society where we respect consent and not tweak it and say when women say this, they mean this. I want to see a society where when a woman says no, that is respected. I want to see a society where we are not blaming survivors who've experienced sexual violence. I'd want to see a happy world.
To young girls and women, I'd tell you that you have the power in your hands to decide what you want to do with your body, and never feel like your choices are wrong. Just make your choices from a point of being informed. Know who to seek help and guidance from. Not just everyone will give you that help. And the number one person you need to believe in is yourself before anyone else.
My advice to young girls in the community is that knowledge is power. So whenever you get an opportunity to be taught, to be educated on matters SRHR, do not hesitate to grab that chance. Also be available, do not be ignorant. Yeah, there are things we know, there are things we see, but we always feel that it cannot happen to me. GBV cannot happen to me, I cannot be raped, I cannot get pregnant early. Don't be ignorant. Whenever you get the chance, get the knowledge.
ICK!